All right, Dr. Paolini, the floor is yours. Thank you for being here with us.
Well, thanks everybody for showing up tonight to learn a little bit about sinus disease, allergies, and everything in between. Just a little bit about myself. I'm from Buffalo. I trained at the Jacobs School of Medicine. Then I did a general surgery internship here. Then I did a research fellowship at Children's Hospital for vaccine development for ear infections. And then I did my residency here in Buffalo at UB, and I am board certified in otolaryngology, which is otherwise known as ENT. I do specialize in sinus and nasal cavity conditions. We also treat ear infections, allergies, and pretty much all ENT conditions. My love and, passion, I guess, is really sinus and nasal disease. So that's why I'm doing this talk. So let's get started. And Mark, we got a little problem. I can't advance.
There you go.
There we go. There we go. Okay, so we're going to have the agenda here is we're going to talk about different sinus conditions, nasal conditions. Then we'll go into what is sinusitis and the different types. We'll talk about the causes and symptoms, the different treatment options, and in some cases, sinus surgery is indicated. So we'll go over the conditions you need to have sinus surgery and the different types, including in-office procedures. And then, of course, we'll go into some questions. So what are the sinuses? The sinuses are basically air-filled sacs inside your head. And there's multiple sinuses. They're actually developed embryologically to lighten the load of the head. You think the head, if it was completely solid, it would really put a strain on your spine. So that's why they were developed over time. And like any air-filled cavity, they have to be drained because of atmospheric pressure and changes in the weather, and they have to have drainage ports. So they have to stay open to be healthy. So there has to be an open drainage port between each sinus and the nose. So any inflammation from a virus, a cold, allergy, any type of irritants can cause swelling and blockage of the sinuses, and that can lead to obstruction and eventually sinusitis. Bacteria love inflammation, warm, dark places where there's mucus, and then they take over. And this is what they do. So we're going to talk about how we can prevent that and what different options are. Mark, I don't know why these lines are coming up on my screen. If you can see that, I'm not sure what that is. I'm not certainly doing it. I have a giant circle on my screen, and I apologize for that.
Yeah, it looks like maybe you grabbed the pencil, Doc. There's a little green pencil on the side there. Like I'll scribble right here. I got a blue one. It's right over your mute mic. So you might have grabbed that by accident. But let me see if I can undo these real quick.
Okay, I apologize for that, folks.
That's okay. I think I can undo mine, but I can't undo yours. So
Okay.
if you hover over your mic, there's a little green arrow. That's probably where you're picking that up, Doc. Otherwise, we'll just blame it on my kids, and they got a hold of your power.
Okay. All right. So when there's changes in seasons, that can make sinus conditions worse. So one of the things is obviously in the wintertime. Wintertime, the air is extremely dry. When the mucus dries out, it tends to sludge and it can get stuck in the little sinus drainage ports. So that's where humidification in your home and your bedroom can help. Saline irrigation can help with that too. And then we, of course, have the seasons in the spring, fall, and summer where you have different allergens, pollens. So some people only have sinus problems in the spring, some have in the fall, some have throughout the season. Depends on what they're allergic to. And that's things that we can look at where we can test you for allergies if need be. But this is a very, very big problem. I mean, this is worldwide. Sinus problems are enormous, and it seems to be increasing in incidence. It could be due to the fact that really people are more aware of it. They have more access to healthcare, but it could also be due to worsening allergic seasons. You probably always hear on the news, or this is a terrible allergy season or something like that. It could be to changes in humidity levels, either too much humidity or too little humidity. So this is definitely a big problem, and we're going to talk a little bit more about it. So here's the thing. How do you know if you have a cold, an allergy, or a true sinus infection? Okay, this is really important. Let's start with a cold. So a cold in general is any upper respiratory type infection that lasts a week or less. You just use that as a general rule. If you've had symptoms for a few days, chances are it is not a sinus infection. So you're going to have your typical congestion, runny nose, sneezing, headache, cough, hoarseness, scratchy throat. You may have a low-grade fever. And again, the key is 1 week or less. That's important to remember. Allergic symptoms usually last seasonally. You'll get similar symptoms, but they'll usually last quite a long time unless you're allergic to a specific, say, animal like a cat, and you go to your grandma's house and her house is loaded with cats and you get the itchy eyes. So again, the duration will be as long as the exposure is to that particular allergen. Now, sinus infection, think greater than a week. That's the key. So people call all the time and they're like, well, geez, I've had a runny nose for 2 days. I want an antibiotic. Well, that's really not helpful or healthy to do that. You don't want to do that. And we'll talk about ways you can treat sinus infection, cold related symptoms. So usually when the cold starts and then it doesn't clear, the symptoms are going to change a little bit. You're going to get more nasal congestion. The mucus will get thicker. It's oftentimes discolored. You'll be blowing green or yellow out of your nose. Your sense of smell will decrease. You may get facial pressure, headaches, eye pain, fatigue, and sometimes even your breath can smell bad. But again, it's similar to a cold. It's just really the duration is the key. So now we'll focus on sinusitis. So what actually is that? It's also known as rhinosinusitis because really it affects both the nose and the sinuses. Sinusitis in general means inflammation of the sinuses. Now, this can be what we call acute, or it can be chronic. Acute is anything that lasts 3 weeks or less, and that's generally treated with antibiotics. Chronic is a completely different condition, which is caused by things other than, say, a virus or an allergy. That's due to almost what really is a defect in the immune system, which causes thickening and polyps in the nasal cavity, which cause more of a permanent obstruction in the sinuses, and that's treated a little different. So acute sinusitis can be viral or bacterial, but usually when we see the patients in the office, it's bacterial. So if you do have chronic sinusitis, you are more likely to get bacterial infections as well, because the sinuses are chronically infected and blocked with this sort of polypoid mucosa, and I'll show pictures of that in a minute. So again, you're just going to get the symptoms we outlined above: facial pain and pressure, drainage, oftentimes it's colored, loss of smell and taste, crusting in the nose, and postnasal drip. When we look in the exam, generally we don't often see a lot when we just look inside your nose. You may have a little inflammation. Sometimes we can see some color drainage. Once in a while, we'll see polyps and crusting, but oftentimes we need an endoscope to see the actual pus draining out of a sinus. And that's important really to make a diagnosis. Many times we'll make a clinical diagnosis where we'll look in someone's nose, not see much, but their story is good. They've got, they've been blowing their nose, yellow and green for the past week and a half. They have pain and pressure either in their forehead or in their face, postnasal drip. So sometimes acute sinusitis can be a clinical diagnosis where you don't actually see pus pouring out of the nose. So what are the causes of this? Well, we talked about a few, but how do we treat this? How do you know if it's an infection? Again, it's the time. Think of the timing. Think of the magic time frame of a week, okay? A cold that won't go away after a week generally is a sinus infection. The last thing doctors want to see today is people coming in the office with cold or flu-like symptoms they've had for a few days for obvious reasons. Because A, we really can't do anything for them, and B, they could infect the whole staff. So especially in the age of COVID, we really try to recommend people don't come in the office if they're sick for under a week. Now, there's exceptions to the rule for that, of course, and oftentimes we can even do a video visit with people, which can be helpful. So again, if the symptoms persist and they've not responded to other over-the-counter treatments, that's the time to consider potential additional treatments. So chronic sinusitis is, like I said before, completely different. This is caused by a change in a person's immune system. It affects about 15% of the human population in some degree. That doesn't mean all people have symptoms, but if you look at their CAT scans, about 15% of people will have some degree of this. And it's caused by an overstimulation of the immune system for reasons we don't fully understand yet, which causes inflammation in the nose and sinuses. And then this then blocks the different passages. So the symptoms include congestion, obstruction, pain and pressure, and headaches. They'll often be crusting in the nose. Many times we'll see loss of smell or taste due to polyps, and they have very thick postnasal drip or nasal drainage. This is not always treated with antibiotics. So when we examine someone, this generally is done with a nasal endoscope, we will see inflammation, polyps, which are basically overinflated portions of the mucosa, which grow so large they actually exit the sinuses into the nasal cavity. When we see this, oftentimes we have to get a CAT scan to further evaluate this. And this is what a polyp looks like. If we look in the nose with the scope, you can see in the middle here, right in this area, this is a nasal polyp. This is what it looks like. So this would be your nasal septum. This would be the side wall. And these are what the polyps look like. And you can imagine how much trouble that causes someone breathing. And now imagine even smaller polyps are in the sinuses, causing blockage of the sinuses. So this is a CAT scan of this person, and you can see sinuses in general are usually black. That black is consistent with air. So these would be your eyes here. This is your brain, and outside the head is air. So your sinuses should be aerated. So if you look here, you can see all of this material in the person's sinuses with just a little bit of air right in certain areas. So this is a problem.
Okay, it's messed up.
Yeah. So chronic sinusitis, what causes it? We talked a little bit about the immune system, but oftentimes if someone has had a chronic bacterial infection, and I do see these patients, I've seen patients that have had infections in one or more of their sinuses for years, and they've just lived with it. And that can destroy the ability of the sinus to actually cleanse itself. There's tiny cilia in the sinuses, which beat to push the mucus out of the sinuses. And if someone has a bacterial infection for too long, it can destroy the ability of the sinus to do that. So that's one of the causes of chronic sinusitis. Allergies can also cause chronic sinusitis if you're chronically inflamed from bad allergies, and that can be treated with antihistamines, nasal steroid sprays, and in many cases, allergy shots, also known as immunotherapy. So the immune system, when it causes too much inflammation to normal things in the environment, can cause chronic sinusitis. This is in about 15% of the population to a certain degree. But again, not everyone is even symptomatic from this. It could be minor. There was some thought years ago this was due to certain fungal elements in the environment, where certain people had a hyperreactivity to fungus, but that seems to be getting out of favor these days. So we're not entirely sure what's going on in the immune system when it comes to this. However, some of the new agents that you see advertised on television, the injectables, some of these can be very helpful for this condition because it downregulates the immune system. So this ultimately all causes changes to the lining in the nasal cavity and sinuses, which then blocks the sinuses and causes the symptoms. So there's a few things you can do on your own to help with. This is more or less for if you have an acute sinus infection or a cold. You can drink fluids to thin the mucus, but I just want to stress, don't go crazy with the fluids. I mean, we've seen some patients that have come in the office that are drinking 2 gallons of water a day, and it can actually be harmful if you overdo it. So you should stay hydrated, but don't go crazy with the water, because some people think, well, if 8 glasses are good, then 16 are good, then 32 have to be better. And that's really not the case. Resting can help your immune system, which can help get you over an infection. Saline nasal spray and irrigation, neti pots, and you may have seen the thing on TV where it's like a mechanical sinus irrigation device. I think it's called Navage. These are excellent. There's nothing you can do to make you feel better more quickly than just using saline irrigation to clean out your nose. It's low tech, but it really works. Humidification is excellent too. Even getting in a hot shower and just letting that steam get in there can really help. In the old days, they used eucalyptus oil, which basically is a type of a decongestant, which would open up your sinuses temporarily. Maybe your grandmother did this. I know my grandmother did. She would make these hoods for me. She would put the oil in, hot water, and that eucalyptus oil and the steam would get in there and open up your sinuses in your nose. That can be helpful as well if you're looking for more of a homeopathic type of thing. But really, I would say the best thing is really saline spray. So how do we treat this? So we'll start with acute sinus infections. So in the beginning, almost all of these acute infections are started by a virus, because you don't really get a bacterial infection in general into your sinuses. It's usually introduced once a virus has infected you with a cold, for example. It opens up a doorway into the sinuses that allows the bacteria, which are everywhere, including in your nose, to get in and take over. So this is over a week and you're starting to have color drainage. It most likely is a bacterial infection, and antibiotics can help that. You can take pain relievers such as acetaminophen or Tylenol or ibuprofen, otherwise known as Motrin. These are very, very helpful. Steroid nasal sprays such as Flonase or Nasacort. The generic term is fluticasone or mometasone. You can find these over the counter. and then saltwater irrigation in the nose. Oftentimes, if the infection is particularly bad, we may give patients not only an antibiotic, but a short course of oral steroids, which rapidly reduces the inflammation in the sinuses, which can help you feel better faster. Rarely do we need to do surgery for acute sinusitis, but there are cases where they get out of hand and we cannot control them with antibiotics, and we have to surgically open up the sinus to drain the pus out of a blocked sinus. Every once in a while, an acute infection will, if it's in one of the sinuses next to the eyes, it can cause a problem with the eye, or even the brain for that matter. So we have to make sure that the infection is clearing, even though it's an acute infection. Chronic sinusitis, similar but different. Nasal steroid sprays are the main treatments. If you have chronic sinusitis, you want to stay on your Flonase or your Nasacort or your fluticasone all the time, because this is a lifelong condition. There's really no cure for this. What we try to do is mitigate the symptoms with medicines or surgery, but the nasal steroid sprays really are the main thing you want to use. Even if you feel good, you want to stay on these sprays. And remember, if you do use any type of spray in your nose, you always want to shoot the spray toward your eyes, because that's really where it's working, because your sinuses aren't here, they're outside. Saltwater irrigation is also very helpful for this condition. Many people with chronic sinus infections will get an acute infection, and we'll give them antibiotics and steroids if necessary. If we can improve your symptoms over a certain trials, then a CAT scan is very important to determine what's going on up there. Sometimes it's difficult to fight the insurance companies, but we always win eventually, and we'll get your scan if need be. So then that leads us to, well, if that doesn't work, what do we do? That's where surgery comes in. And again, we try our best to avoid surgery in patients, because many times we can treat people with medications. And I usually tell patients, when they have chronic sinusitis, I go, look, you've got chronic sinusitis, your scan shows, thickening and whatnot. You're going to tell me when you want to have surgery, because you're going to say, doc, I can't take it anymore. Let's do it. And that's generally, for the most part, how we work this. So there's two options for surgery. The first option is what's called endoscopic sinus surgery, which is where you go to sleep generally, and we use nasal endoscopes. We have a giant computer screen that shows us where we are exactly inside your head and your sinuses, because when you think about it, your sinuses are near your eyes, they're near your brain. So this is very delicate surgery. So we use what's called navigation. And that's why we always have you go, when you get your CAT scan, you want to go to a very specific center that can do the proper CAT scan, so we can kind of merge that with our equipment in the operating room. So we use that basically, and we use all different types of instruments. Every case is different, to remove the polyps and to open up the sinuses surgically. Generally, this is for moderate to severe disease. If you have very minor disease and just a few sinuses are a little bit blocked, sometimes it's even due to anatomy. You may have been born with a sinus which is congenitally narrowed. You can undergo balloon sinus osteodilation. That's done in the office usually. And that can be done with or without navigation. And generally, the recovery is much easier, because we're not actually removing tissue. We're just making small holes bigger. This will not work if you have a big polyp load or you have bad disease. So just to talk a little bit more about endoscopic sinus surgery, it's all done through the nose. And basically, think of, I joke with my patients and say, I'm basically a plumber. I'm unplugging your pipes. I'm going in there and I have to remove what's blocking your sinuses. And the goal is to make small holes bigger, basically, is what it is. But in order to do that, we have to remove polyps, we have to remove tissue, and there are risks involved with any type of surgery. Bleeding is a risk, recurrent disease, a lot of things which we would go over in detail if you would ever need surgery. But that's basically what it is. We have to go into every single sinus which is involved, remove pus, remove tissue to open up those sinuses so that air can get in. And this you can see on this diagram here, you can see here the holes are very narrow on this side, and this would be after the surgery to remove this, and then this is filled with pus. This would be generally considered a minor surgery because really only one sinus is involved. So this could be done with a balloon, or you could do it under general anesthesia. The problem with balloons, though, is that because you cannot remove tissue, oftentimes the hole that we can make with a balloon is really not quite big enough, and oftentimes it can recur. So this gives you a little idea of what balloon sinuplasty does. These are little tiny instruments that we place in the nose, and they're curved, and we get them into the little blocked sinus. We put a little balloon in here, we inflate it, and then we can suck out all the bad pus or whatever it is. Oftentimes we'll flush the sinus too when we do that if there's infection or whatnot. But again, with a balloon, you can't always remove tissue, or usually don't remove tissue, and that makes it only useful for more minor disease. So one thing about balloon sinuplasty is that it's easy for the patients to recover. I wish everyone could be a candidate for this, but unfortunately they're not. But for those that are, it's great, because in theory you could go back to work the next day. According to this data here, 500,000 people have had this. I think it's much higher than that now. I think it's probably in the millions at this point. Very fast recovery. 70% of patients that have had it said they would do it again. Again, because it's not very invasive. And it's done in the office. Generally, it's done with general anesthesia. I'm sorry, with a local anesthesia. This is just another look at how it works. This is a frontal sinus here. These are the ones above the eyes. The balloon goes in, a guide wire goes in, then the balloon is followed up into the sinus, irrigated, and then this is the after picture with the sinus dilated. So if you notice here in this picture that that's the only sinus which is involved, the other ones are nice and clean and there's no polyps in the nose. So this person would be a good candidate, if this was a real person, to do this procedure. Usually patients tolerate this very well. We have very good techniques where we numb the nose. We've learned over the last, I would say, 15 to 20 years since this was first introduced, how to really get the anesthesia down. So the discomfort level is very minimal. So is sinus surgical treatment for you? Well, not for everyone, I can tell you that. It shouldn't be for everyone. It should only be for certain people, those that are not controlled with medical treatment that we discussed. If you've had recurring bacterial infections 4 to 5 a year, and you're in the immediate care, your primary or our office, probably a candidate. If you have large polyps that are blocking your airway for breathing, well, that's a no-brainer. If they can't be shrunk down with conventional therapy, such as steroids, nasal steroid sprays, or other medical options, then certainly removing the polyps from your nasal airway would be an option. Many times, and I would say greater than 50% of the time, sinus surgery is done in combination with a nasal septoplasty or reduction of the inferior turbinus, which is nasal tissue on the side of the nose, which swells when you have a cold, because oftentimes people have both problems. And if you have a very deviated septum, if it's bent, the surgeon can't actually get to the sinuses because it's like hitting a brick wall. You have to actually straighten the septum before you could even get to the sinuses. So ultimately, this is really a decision between you and your surgeon. And like I said before, patients usually tell me when they want surgery. I don't push surgery on anyone, but if they're ready, we're ready to go. So, but there's many other options. So before we get into frequently asked questions, I wanted to bring this up. It's not in the slide presentation, but I wanted to bring it up about how to treat a cold. You know, when I go into the pharmacy, and I'm an ENT board certified physician, I get confused when you look at the thousands of these cold remedies that are out there. It can be very confusing. So a couple of rules of thumb. You have decongestants, and really the only decongestant that works orally is pseudoephedrine or Sudafed. The other ones really have not been proven to work. The problem with Sudafed is you have to ask the pharmacist for it because they hide it because of the whole Breaking Bad thing and all that. So you have to ask the pharmacist to get it for you, and they'll give it to you. You have to sign some papers, but you want to use a decongestant if you have trouble breathing or if you have sinus pressure, okay? And this is important. You don't want to use it for too long because it can raise your blood pressure. If you have thick mucus, you want to use what's called a mucolytic agent, and the best one is Mucinex. Mucinex has products which I think are excellent, and if you really want to cut through the whole chase on this, they have 3 basic products which take care of, I'd say, 90% of cold related issues. They have the regular Mucinex, which is just the mucus thinning agent, which is just if you have like some congestion in your chest or you have thick blowing your nose, but you don't necessarily have pressure. The regular Mucinex is perfect to use, and you would use that twice a day. Always buy the extra strength one when you buy it. That's very important because you need that higher level to get the effect. You always want to take a full glass of water when you take any type of Mucinex product as well, because it works better. The second type is called Mucinex D. That's the mucolytic agent with a decongestant. That's, again, if you have sinus pressure, trouble breathing, and you have other symptoms we discussed before. That, again, you have to ask the pharmacist for. Then the third one is called Mucinex DM. DM stands for dextromorphan, which is a cough suppressant. So if you're coughing, you have this drainage, you're coughing like crazy, Mucinex DM is perfect. So again, I don't have time to go over all the different cold remedies, but remember, mucolytic agents, decongestants, and cough suppressants. That's dextromorphan. If you really stick with those products, you most of the time will be in good shape. So let's go on to the frequently asked questions. What is the average recovery time for sinus surgery? I would say, I'm looking at this here, and I would say, yeah, the discomfort, the first 5 days is usually the worst because that's when you still have some residual absorbable packing in your nose. Sometimes you'll have stents in your nose if you have a septoplasty, which is a tube which allows you to breathe. One thing I will say is that it's not nearly as bad as it was 15, 20 years ago. We have much better packing agents and things that make it way more comfortable. But the first 5 days or so is the worst. We do usually prescribe some narcotics, but people usually do okay with Tylenol, sometimes Motrin. You're definitely going to have some drainage out of your nose out of the first week. I tell people, assume you're going to bleed for, 5 days or so, sort of a slow bloody ooze. That's normal. If you don't, it's a bonus, but I always tell people, assume you do. You will definitely have some congestion until your nose is cleaned at your first post-operative visit. You do want to limit your activity for 2 weeks. That means no strenuous activity, but you can go for brisk walks. You can, many people can work from home. You could go out to dinner if you feel okay, but you're not like bedridden. You do have to have, if you have a conventional sinus surgery, at least 2 visits after surgery for debridements. The debridements are part of the surgery. People don't understand that. Is that once we scrape the sinuses and we put some gel or packing in there, that has to be removed surgically with endoscopes, suctions, and other instruments, or else the surgery will not be a success. So it's actually considered, it's essential, really. That is usually not very pleasant. We do our best to numb up the nose, and we usually tell people to take a pain pill before you come in. It's not that bad. I tell people, it's like taking a Band-Aid off. It's got to go. You got to do it. I would say the vast majority of people are completely back to normal in a month, if not sooner. Balloon sinuplasty, really, again, it's really reserved for milder cases. The recovery is dramatically different. We don't put any packing in. I should say we almost never have to put packing in, but your activity limitations are much less, ranging from days to a few weeks. In theory, you could go to work the next day if you felt up to it. We usually don't prescribe any narcotics because there's very little pain after this, nothing more than Tylenol or Motrin. So balloon sinuplasties can be performed in the office under local anesthesia, but endoscopic sinus surgery, as mentioned before, is generally performed at a surgery center. Sometimes we'll do some very, very advanced cases in the hospital. And it is covered by insurance in almost all cases. I mean, every once in a while we have a problem, but that's very, very rare. And the reason is because in our practice, we don't do unnecessary surgery. Believe me, if you need surgery, you need surgery. We don't try to get stuff through that really does not merit. So again, Mark, I'll let you open it up now for any additional questions. I'm happy to ask, to talk on whatever.